Hi, I'm Vinganam Veerapen. I'm 67 years old now. I'm a retired preschool principal, and recently, within a year, I had 2 heart attacks. Talk about previously whether I had any medical problems or not. I could say mostly not really, except for my knee pains. And whenever I went for my medical checkup 6 months once, the doctor will tell me that I'm perfectly all right, except that the cholesterol level is a bit high. And I'm very bad at taking medicine, so I used to skip a lot of medications. Maybe due to that, I had these attacks. I presume that could be the reason, because I didn't take much of my medications properly, especially the cholesterol medications, which was the only one that I was prescribed. And I was happy-go-lucky guy, I used to do my normal activities as per normal before the attack. When I realized that on that day of my first attack, I think it is mostly due to anxiety, as I was doing some kind of a gathering, a video zooming with my students from NIEC, and I was talking to them. When I could recall that on the day, actually I went for a hair treatment. I was keep on thinking of what are the questions that the students will be asking me for the Zoom session that I will be going through. So when I came back home and when I went on the Zoom session, I don't know, I didn't expect much of question, and they didn't ask me. They were so friendly, but the anxiety topped me up, and I had started having chest pains, which I never happened to me at all in my life. So I know something is so totally different, and I was sweating a lot, and I thought it's a normal, usual kind of chest pains, So I went and took my bath, and still it didn't go off. So I had to call my son-in-law to come and check, because he's on a medical side. He's working on a medical side. So he asked me many questions, whether I had this breathing problem, or where the pain came, and what kind of pain, how does it is a pulsating pain, or kind of different questions. So when I answered all, he immediately took me to NUH, A&E. Most probably he knew that it is an attack. So life went on. Exactly 1 year. That was my first attack was on 28th of January 2023, and exactly 1 year this year, 23 or 21st of January 2024, I had another attack. It was the same kind of anxiety, kept on me, and I had the attack. But this time I was a bit aware, and I knew this is the heart attack, because they also told me, the nurses and the doctors told me, this is how the attack will be, what kind of pain is that. And so they gave me a kind of pill, I do have in my handbag, that pill put under the tongue and all that. Even after putting under the tongue, it didn't subside. So I was brave enough to take a Grab all by myself with my husband, and went to A&E. And of course they did another angiogram with me, and this time it was the attack is in my heart, with the veins blocked in my heart, with the hairline veins, which they couldn't do much of the stents. So what I did was, okay, if it is that, what is the other things that you can do for me? They said it is only through medications. We can't do much of any stents or anything. So I said, well, I'll be under their supervision all the time. So I said, okay, I'll go ahead with that. So they discharged me after a few days because they were observing whether I'm getting it repeatedly or not. After that I didn't, and then from the previous last year, 1 year ago, the medication they just changed, not changed, added one medication, that's all. And till now I'm taking all the medications now. So far so good. I don't get any pain or anything, or even giddiness also very less. But I'm trying to avoid all kind of stress, anxiety and all that, because just recently, a few days ago, my own sister passed away, and I was a bit close to her, and I try not to get into stress or things like that. I try to console myself, that's all. Yeah. The doctor recommended me to go for kind of cardiac exercises at NUH itself for a month. Two times or 3 times a week I went there, and I was a bit happy there, because was contented there, because there were doctors by the side, and the physiotherapists and the nurses were all around me, and should something happen to me, they were all beside me, and all the time they were taking my blood pressure and pulses and everything. And it was, I think, during COVID time that they were more aware of the germs around, and they will be cleaning up, and they were very, very good nurses and very, very good physiotherapists. They were around to look after me and taking care of me, and they were advising me on what to do and what to eat and things like that. And after a month, they referred me to Bukit Gombak Heart Center. And when I came and registered here, I was first kind of hesitant, because there were no nurses around, only physiotherapists around, and no doctors around. Because should something happen to me, or should if I faint or things like that, what should I do? But then the physiotherapist there assured me that everything is at hand. I must be very thankful to Mr. Greg, physiotherapist, and Chairman, and Chairman, I think the Chairman also, I think, upcoming physiotherapist, and another one is Aileen. The three were very, very good, and they were all the time, they were at hand, and they will call me to ask me whether I'm all right. Especially Mr. Greg, he'll be with me all the exercises, and he'll tell me how many repetitions that I should be doing. If I have the knee pain, and he'll be telling, no, you just relax and don't do this, don't do that, and this is good for you. So every minute I could see him with me all the time, with compared to the other patients who are doing the exercises. So I'm still under their tutelage, I can say that. I go for go to the heart center for the rehabilitation exercises twice a week, and we do normally. I start off with my treadmill exercise, and for 10 or 15 minutes. Then I do all the cardiac body part of exercise first, then I go on to the limbs and chest part, and my legs and hands and all that, about an hour. And after that we will take before and after the exercises, we do take the blood pressure, and we do that. We will end up with that. I'm at good hands, so should something happens to me, there are physiotherapists at hand to protect me or send me to hospital or something like that. That's what attracting me to go to the center to do the exercise, rather than going on myself to the gym or doing exercises on my own and all that. Because even in myself alone, at times if I go for a long walk and all that, I feel kind of a little giddy and all that. I feel scared that something will happen, so I will just come back home. Since my first attack, it was 1 year, and now it is second attack, another almost past 6 months, 1.5 years, and that attacks and the medication didn't stop me from enjoying my life, in fact, or looking forward to live a good life. I do go for my holidays I did go quite a number of countries. Even just recently, I went to Europe and Japan and all that. I look forward to a happy and healthy life. I do take my meals regularly and kind of enjoying my life with my grandkids and my family. In fact, I'm all the time. In fact, even before my attacks and all that, I was on a good diet, but just wonder what has gone wrong with my body. It is genetic because my father had high blood pressure and my mother had high blood pressure. So it could be genetic or what, I wouldn't know. So that didn't stop me from eating food, but I'm only on the conscious side. And also from the heart center, I think nutritionist or dietitian, they will come and advise me on the things that what to eat once in a while. So they will also advise me further. So it's all depend, and it doesn't stop me from enjoying my life. In fact, I'm planning more for holidays. As long as I'm here, I want to live a happy life and a contented life with my family, especially with my grandchildren. I feel that life is short. That is what I came to know. We should, as a person or as a living person, I think we should be taking a good diet as well as good exercise. And if suppose say you are diagnosed with a kind of a sickness or whatever it is, I think you should really take the advice of doctors or physiotherapists or whoever. To take the medication properly and do the exercises properly, which will help us to live a happy and satisfying life. And as for me, I do took the advice of my physiotherapist, and I really go for the exercises, and I did the cardiac exercise and things that it made me very movable, very energetic, and very brave to go for to enjoy my life. And I am very brave to go overseas for my holidays and all that, because I know I am capable of walking and things like that. Enjoy your life as much as we can.